more sound.
All right. Need more
Yeah.
sound. Okay.
111.
I'm going up.
Someone said
I'm blowing
111.
out the speakers pretty soon.
Yeah, 11 is right. Pump up the jam. That's basically
Better.
what you're
Okay.
saying.
All right.
Okay.
Okay. I hope this is good now. Okay. Excellent. Thank you, Bridget, for letting us know. All right. Welcome to the podcast. Now, last week, if you were here, we did ADHD, and it wasn't the best audio quality, and there's a lot of questions that went unanswered. So we hope to get to more content that we didn't get to last time. And so once again, I have Dr. Hizbay Ali, double board certified psychiatrist, joining us again. So thanks again for being here.
Thanks, Dr.
Love
Hanson,
having you here,
yeah,
honestly.
for having me.
And so the way that we're going to do this, we're planning on going for about an hour, and we'll hit on some ADHD topics or subtopics, and then for the last half hour, we'll do questions. So stick around for the whole time, and this way we will hopefully get to your questions. And then next week, we plan on doing this again on a different mental health topic.
Right.
I was thinking depression or anxiety. Is that
Yeah.
something
Yeah,
you'd want to do?
I think that's perfect, probably.
Okay. Yeah.
Thing to go segue into. I'm sure we have a lot of questions on that. It is one of the most, prevalent kind of things that people, talk about and having. So yeah, of course.
Yeah, and especially because there's a lot of overlap, not only in the actual diagnoses, whether it's ADHD, bipolar, anxiety, depression, and it's really hard to sort out these diagnoses because it's very much not only overlap, it's also very much a gray area in terms of figuring it out, right?
And depending on the nature, right, of what is the underlying cause, and we're going to talk about nutrition.
Yeah.
Obviously, playing a huge role in your mental health.
Yeah.
It's not you don't necessarily have to have medications as an answer. You can do lifestyle and behavioral and nutrition modifications. That's the whole point. We're not trying to push any product. Sometimes you need medications, and so we just want to destigmatize.
Yeah.
What depression, anxiety are, and also how you can manage it for people who are serious about wanting to get better themselves through lifestyle modification.
Yeah.
That's really the whole thing, right?
So, what would you say is one of the most common overlaps? Because you mentioned oppositional defiant disorder, bipolar.
Right.
Right. So how do you go about like figuring that out? Is it do they have both? Is it definitely one or the other? And how do you go about figuring that out?
I mean, that's an excellent question, and that's probably a lot of people I think asked that in the last podcast too,
Yeah.
or they touched on it. A lot of people don't think ADHD is a real diagnosis.
Mm-hmm.
Right? There's the whole school of thought that it is behavioral. It's a behavioral modification can fix it. Again, I'm going to leave that up to the experts that want to debate that. But clinical experience in neurocog science, like functional MRIs and things like that, do show that there's some, whatever it is, like however you want to define it, and it's multifactorial causes of it, which is just not just genetic. There's a genetic component. But like just the actual symptoms of inattentiveness, impulsivity, hyperactivity, right? Those are what we're actually talking about in ADHD.
Right. So attention deficit hyperactivity disorder.
Right.
And then if there's no hyperactivity, then it's just attention deficit disorder.
Right. So if you want to talk about the subtypes,
right,
which right now, DSM, they're the 3 subtypes, which is there's one that doesn't have it's more just attention is the issue.
Okay.
Right. And then there's like the hyperactivity, impulsivity is like, or one of them too, in the combined type. I'm sure, the thing is like, it's like you can almost like differentiate it even probably further if you want to really get into the nitty gritty. But vaguely, I think you can probably think of it as like inattentiveness and impulsivity and hyperactivity as like the kind of key features. Some people don't have the hyperactivity, and some people do.
Yeah,
but less impulsive,
and it's usually impulsive. Boys more than girls, correct?
That's a again, that's a big and a controversial point as well.
Okay.
If you look at the epidemiology, it's more prevalent in boys. Hyperactivity part, of course, and boys are more inattentive and hyperactive.
Yeah.
And maybe that's something that, like we talked about the school systems, how it's a one size fits all.
Right.
Boys are more likely to succeed in things like trade school and things like that. To get them like hyperactive kids, like putting them in something that's structured and doing something as opposed to forcing them to, do something that they're not going to pay attention to and be disruptive and just modifying like the.
And that's why, we're talking about team sports, for youth, right? And why. Right. it's not just one reason. It's like 100 reasons why it's really great for kids to get involved in team sports.
Yep. Structure.
Structure,
There's just the team, spirit,
exercise.
exercise, camaraderie. Like you're not singled out. Like for you're actually, and you're channeling the energy, channeling the hyperactivity, and then they get tired and exhausted by the end of the day. So it's great for sleep hygiene too.
Yeah,
Right. They
yeah.
get to like expend their energy.
And basically, not focusing so much on the self and putting the team first, and
Right.
yeah, and working as a team and
Having goals.
having goals, right?
We're going to talk about behavioral stuff that parents can do and even adults do for if you have ADHD, or if your kids have ADD, which is setting, putting like limits on yourself, things, scheduling your day, right? Scheduling your day and
Right.
having goals in
Right.
sight, because left to your own devices, an adult with ADD without structure, it can be a lifelong thing. It can affect your life, your relationships, your work. It actually affects people, not just the person, but whoever's around them also negatively.
Yeah.
And that's what a lot of people miss. So ADD, ADHD, I know some people might say like, hey, it's a moral failure and you need to be disciplined.
Well, but the thing
That's
about that is, how can you say that when there's actual functional MRI evidence that shows that you have volume loss of the prefrontal cortex in other areas of the brain too? I know even the cerebellum is affected.
Right.
Even some studies showing the hippocampi are affected.
Right.
So these different areas of the brain that literally have volume loss that have been studied and directly associated with people with ADHD.
Right. Great point. Yeah, prefrontal cortex.
Right.
The prefrontal cortex is what modulates, kind of the impulsivity that arises from the amygdala and hippocampus and the limbic system.
Right.
So the prefrontal cortex is sort of our like ability to just self-regulate and self-modulate, not just our emotions but our attention.
Right.
Right. So yes, that is what the functional MRIs show, that there is deficiencies in that, and we know this because when you take stimulants, it does increase dopamine in those pathways.
Yeah.
And it does enhance your ability to concentrate and focus and pay attention and regulate your emotions.
Yes.
So those are key things that yes, that's there. I think doing behavioral modification will strengthen those circuits, right? Like obviously, like it. So I would say it should never be thought of as like one or the other, either or. It's always an and kind of approach in mental health. Lifestyle, diet, all those things. And then if you need medication, and sometimes you need medication to be able to do the therapy, right? People that are really inattentive.
Yeah.
How are you going to make them go to therapy and pay attention to the therapy?
Right. If they can't even pay attention.
They can't even focus.
Right.
Right. So how are you going to do that?
Right. And then
getting a kid to do that, right?
Yeah. And we talk about, behavior modifications, including nutrition, right? And the things that are most studied in terms of nutrition with ADHD,
right?
We talk about things like preservatives and chemicals like Red 40, right?
Yes.
But also sugar, and then omega-3s. Those are probably the biggest things that are being studied when it comes to nutrition and ADHD specifically.
Yeah.
But we also know that nutrition, as applies to general brain health and general health in general, it's basically, the studies show that when you're eating an unprocessed food diet, so it's not really diet, it's a lifestyle of just eating unprocessed food, which whenever you eat unprocessed food, that naturally means you're eating food with lots of fiber, soluble and insoluble fiber. Both are very important. You're also getting omega-3s naturally, and you're also getting, you're naturally not eating a lot of added sugar, And when you do all these things, brain health is at its best. You're naturally getting enough vitamins and minerals and antioxidants.
Right.
And so when you're actually eating unprocessed food, that's when the brain is working at its best. And when it applies to ADHD specifically, they have tried looking at these things, but there aren't a lot of studies that specifically look at unprocessed food and ADHD.
That's the field coming up.
Yeah.
That's actually, that's a nutritional, health, nutritional psychiatry is actually like a new thing now, because they've realized, yes, the gut brain connection, right? They've kind of already known that, but they haven't done a lot of specific studies to be able to, it's a tough thing to do, but I think they've absolutely done the health of your gut flora and how it influences, your metabolism, and also the, neurotransmitters, regulates and modulates neurotransmitter activity as well.
Yeah.
Like serotonin and dopamine.
Right.
Absolutely.
Right.
Beyond just that, you probably know more of like at a metabolic level.
Right.
Cellular metabolic level.
Yeah.
I'm talking about neurotransmitters, stuff in the brain, but absolutely, yeah, absolutely. So,
And it doesn't start just like, okay, you start eating unprocessed food when you hit 16 years old. It's really when you're from the time when you're in the womb, when the brain is developing and what the mom is eating, because what she's eating is going to cross the placenta,
and
including
epigenetics.
fructose.
Epigenetics is a whole field that, again, the last 10 years has probably really exploded and shown the power. This is how you can reverse the ill, right? Metabolic syndrome, you can reverse it. That's the whole point. That's why we're doing this, is because we want to help people understand that this isn't like, hey, you're doomed.
Right.
You actually have a lot of control.
Yeah.
Over your mental health.
Correct.
More than you think.
Correct.
Some things you can't control. Like, we live in a society that expects us to make a lot of money, and we're stressed out about finances and things like that, and
right.
Family relationships, and we're living in turbulent political times. So everyone's anxious about a lot of things.
Right.
What can you do to make yourself like emotionally well regulated and be in the best cognitive health?
Perhaps diet. Perhaps whatever you have isn't reversible. Maybe it is reversible. Yeah. But at the very least,
most of it is reversible.
Right. But at the very least, it can be improved.
Yes.
And perhaps to the point where you don't need medication.
At the very least, it will reduce the amount of worsening that it's getting, right?
Yeah.
Just like with, cognitive disorders are like dementia.
Yeah.
Right? We talk about dementia. That's obviously a lot of related to nutrition and diet also.
Absolutely.
Alzheimer's.
And when you look at things that improve dementia, things that improve depression, things that improve anxiety, things that improve ADHD, things that improve basically all these things, or most of them. It's what we keep saying the same things over and over, and we know, like exercise. Okay, exercise for one, especially aerobic, but it's really all forms of exercise. It increases BDNF, brain-derived neurotrophic factor, and that protein specifically helps our neurons help to make new connections, new synapses with other neurons.
And aerobic activity has been shown to help improve the symptoms of ADHD, like cognitive symptoms like attention and concentration, probably because it helps do that, right?
Yeah.
Like increases your healthy adrenergic tone and dopamine production, and brain-derived growth factors. So like making new connections, of course. Like
so also things that also increase BDNF. We know intermittent fasting, ketones. So beta hydroxybutyrate is a ketone, which is generated, which can also be from the keto diet, but also intermittent fasting will generate these ketones like beta hydroxybutyrate, which specifically acts on the brain to increase the BDNF. And that also helps with forming new neuronal connections. So intermittent fasting is especially great for the brain because the neurons of the brain need to have mitophagy. They need to have autophagy, which is where the cell essentially is replenishing or repairing itself. And it keeps it fresh. It gets rid of the garbage. It recycles parts. So it's keeping the brain cells working at their best. So we know intermittent fasting helps. You hear a lot of people say they have better mental clarity when they do intermittent fasting.
Yeah.
And in my experience, I like that too. I feel like that's true with me. But I hear a lot of people, especially when I make a intermittent fasting video on my YouTube channel, a lot of comments. All of my mental clarity is so much better.
Yeah, I mean, Matthew McConaughey in his book, right? He did. Actors do it. They do it to cut weight. I think for Dallas Buyers Club when he had to, and he did that intermittent fasting.
Yeah.
Obviously, it's unhealthy to a point. But when
there's a healthy way and there's an unhealthy way to do it.
He had a nutrition coach, as the Hollywood actors do. He talks about it. I think he talks about how like mentally sharp, that was the best he felt and thought ever in his life. Yeah. And he cut weight. What we would probably think as underweight in this day and age, because everything shifted because of the average BMI is like, we think it was that way, but so he probably was healthy for a good chunk of time before he went into the probably under healthy range for the scenes where he had full-blown AIDS. But so I think he was doing keto, and of course, I mean, it improves your cognition, right?
Right. So we talked about exercise in the brain. We talked about intermittent fasting in the brain. We talked about nutrition in the brain. We touched on it anyway. The one thing we didn't really talk too much about nutrition is fiber. So we talked about soluble and insoluble fiber, but the soluble fiber, right?
Why does it matter?
Yeah. So the soluble fiber is important because for one reason, the bacteria in your gut actually take that soluble fiber and they eat it. And the byproduct, or one of the byproducts, is something called butyrate or butyric acid, which it gets absorbed into the body and it has anti-inflammatory effects, and that includes in the brain. So it's good for your brain health, that butyric acid. The insoluble fiber, which hardly anyone gets enough of because it's all So
It's stripped out of processed foods, right? All processed foods are basically almost stripped.
the only
Strip out
way
the
to get
fiber.
insoluble fiber is to eat whole real foods. So
Yeah,
things like vegetables, the fruit has it as well, seeds, nuts, but also legumes, whole intact grains, quinoa. So this is where bread. Okay, bread doesn't have
yeah. Sorry about that.
insoluble fiber. When you see fiber with 42 grams of fiber on that bread loaf,
Yeah,
it's all soluble fiber. It's not insoluble fiber
right,
because when they actually process the bread, the milling process, they take that wheat and then that wheat actually has the bran on the outside, then has
right.
the endosperm on the inside, and the germs at the core, right? So the bran is actually that outer fiber layer that's all stripped off,
Yeah,
and then they also get rid of the germ. So they keep the endosperm, and the endosperm is what flour is. So whatever kind of flour you're talking about, that's the
right,
endosperm, right? And so you're getting rid of the vitamins
right.
and minerals from there and the fiber, especially the insoluble fiber, and
Yeah.
you basically eating the endosperm.
So I
And then
mean,
the
what's the
problem is, so
healthiest
no,
bread
hang on
then?
here. So and then what they do is they add the soluble fiber back to the bread. That's why it's 42 grams of fiber. But you can't add insoluble fiber back. So the
Right,
insoluble fiber is gone
it's
once they
gone.
process it. And that's the problem is most people don't get.
And the insoluble fiber fills you up, also, right?
It keeps you feeling
It
full
gets you
for longer
full. You
periods of
strip that
time.
out, like people
And
are just like,
not
yeah,
only does it keep you feeling full for longer periods of time, but it actually slows the absorption of everything else, including
right,
sugar. So whatever sugar you
yep,
do eat, it's absorbed slower. It's digested and
right.
absorbed slower. So you
Glycemic
get
index and all that's like lower, because of yeah,
a lower and slower insulin rise,
yeah,
and that's super important.
that's important. And also you're feeding your gut, microbiome, which is like absolutely important. We were just talking about it, regulating
Yeah,
health. It's the most actually. The gut has autonomic nervous system, its own autonomic nervous system.
correct. It's the second brain
Enteric
of your
system, yeah, it's the
body.
second brain, so it has its own nervous system.
Yeah,
So which is very regulated by the bacteria and the composition of the bacteria in your gut.
yeah,
There has to be a healthy, ratio, which is why they sometimes people have to have fecal transplants, as we know.
yeah,
In modern day, a lot of it's because of antibiotic resistance and things like that happen.
yeah,
And see the C diff. We hear about C diff all the time.
yeah.
What happens? Yeah, C diff happens because your healthy microbiome aren't there to fight it enough. There's like an imbalance happening.
Right. So
Which you know more about.
basically, it's like your gut flora, the
Mm-hmm.
bacteria in your gut. It's basically like a garden, right? Do you want weeds in the garden, or do you want nice fruits and vegetables in your garden?
And all kinds of good flowers. Like,
Yeah,
so
yeah,
you want to smell the
yeah,
roses, you want to
smell the roses.
yeah, you
Yeah,
want to have all kinds of variety,
right.
healthy variety.
Make the poop smell like
Not the
roses.
yeah, not the weeds and the. But that's what happens when you don't get fiber, right?
Right.
Fiber is like the healthy plant food
So the way it
in
is
a
that
healthy garden.
so the fiber, the bacteria like fiber, and if you don't give them fiber, the good bacteria start to die off essentially, and the bad bacteria
You starve them.
the bad bacteria start
Right.
to thrive. And what ends up happening is if you're not consuming enough fiber, they start to eat away at the mucin layer of your intestine.
Yeah.
And once they start eating away at that mucin layer,
Yeah.
that's mucin layer is protective, and they start eating away at it, and then little microscopic holes are being poked. So then the foods that you eat and all the antigens that you're eating in that food.
And I think the epithelial junctions between the cells like break down. Like the food without being broken into, digested properly or broken down,
Right.
absorbed, and so they have antigens.
So at the microscopic level, these antigens start seeping into the bloodstream.
Leaky gut.
Leaky gut syndrome.
This is leaky gut.
Yes.
Basically, what you're talking about. Right?
Exactly.
And leaky gut leads to probably a lot of cognitive issues and emotional issues, along with, of course, the physical issues.
Because what happens is when antigens start leaking into the bloodstream that shouldn't be there, the immune system has to react to that.
Right.
And whenever the immune system is reacting, it generates inflammation and therefore oxidative stress. And too much oxidative stress ends up damaging our cells.
Yeah, not just I would say damaging our cells, but also inhibiting the ability for cells to function in response to a stress.
Correct.
Right. That's the other thing too.
That's
damaging cells, but also like the inability, like when people are on steroids, that they have the inability to modulate and regulate emotional, when emotions, thought, like all stuff, all this stuff, because of the ability to have those circuits function effectively.
You need your neurons essentially firing on all cylinders. They need to be in pristine shape in order to function at their best. And when they're not functioning at their best, that's when problems start to happen.
I would think of it as like, athletes, like professional athletes, like LeBron James or whoever, they're probably employing most of what we're saying because they, at a whoever they've hired knows the nutrition, sleep hygiene, all the stuff we're talking about. They do all that stuff.
Yeah.
They monitor their sleep, how much REM have you had. That stuff matters for your cognitive health.
Yeah, I
Right.
mean that's a whole nother
That's a
topic
whole nother
in
topic
terms of
we'll get
monitoring
into.
REM sleep and the
Right.
devices that you can use and how
Yeah.
effective is it and how do you change that, and so that's probably
That's another topic, but it ties into ADHD because sleep hygiene is part of the treatment for ADHD, right? Like tiring them out, making sure the kids get good sleep.
Yeah.
Also, if they're on stimulants, of course, sleep is going to be a problem, possibly be a problem as a side effect.
Of course, we know that if you don't get a great night's sleep, your concentration, your focus is going to suffer.
Right.
As a result
So,
of that.
are the kids unable to focus in the morning in class because they're unable to sleep because they're on the tablets at night until what hour?
Yeah, and it all goes together, right? So the more you exercise, chances are the better the sleep is going to be, and also nutrition plays a role, and then it all ties together. So when you sleep better, you're more motivated to work out, and everything.
When you eat better, you sleep better. When you sleep better, you eat better, and it really does is because people stress eat. They get up in the morning, you're like, oh, they're not gonna eat. And yeah, you're right. I think that's a whole other topic for sleep and like why you shouldn't be eating just before you go to sleep.
The thing about the brain, so the neurons, so the lymphatic channels of the brain, they literally during your sleep they drain all the toxins or the byproducts that it's the trash being taken out. So you need your brain to rest in order to allow those lymphatic channels to open to literally get rid of the trash down the chute. So
and the quality of sleep matters a lot, right? The stages of sleep. You need REM, and most people don't get that REM. And most people that aren't that take sleep aids and sedatives, what they don't realize is that they'll knock them out, make them unconscious.
Right.
That's the goal, but the goal really is to have REM and healthy.
Right. And that's why people say, "Oh, I'll drink a glass of wine to help me fall asleep." But alcohol is actually counterproductive. It'll probably help you fall asleep, but then you have the rebound effect of the alcohol, where the brain.
Everything's counterproductive. And speaking of sleep, people probably have questions about kids and melatonin. I would start with melatonin. Sleep hygiene. If you do everything, diet, sleep hygiene. If you have to pick something, start with melatonin. There's no reason to be taking Benadryl or throwing that at people to start with.
Yeah, I mean, I think the evidence is mixed on melatonin. You ask 1,000 people, maybe 500 say it helps, maybe 500 say it doesn't. I don't know, but
I would still try it over giving kids, sedatives because of.
Sedatives would be like a last resort.
Or even I would say Benadryl. Honestly, those things aren't healthy to take every night.
No. Benadryl's not. It's not a good thing to take every night.
It's not, but people do. A lot of people take it every night. Correct. And so again, that's a topic on sleep. But I'm bringing this up because a lot of kids are taking sleep aids, and that's probably has to do with sleep hygiene and more behavior modification. Is really and that comes down to parents. We're going to talk about this. This is kind of it's a tough subject because people want to know about the meds. We're not pushing any medications, and that's only necessary.
The reality is you should do everything you can to have the best possible lifestyle modifications.
Yeah.
You should aim for all the things that, in terms of lifestyle things that you can do. And way before you ever get to
nutrition.
Meds.
Exactly. Way before. Because you can mitigate a lot of the symptoms, right? So we're going to talk about nutrition. We were talking about nutrition. That's our main thing. They looked at the omegas and the artificial colors added, and I think the one was the what's it called, the food restricted food diet, what's that called?
Oh yeah, the few food diet.
The
few food diet, which that was they ate quinoa and
so that has to obviously be studied more. I think that's something that's still kind of out of all of them, they've that probably has some benefit because I'm sure it's unprocessed.
Yeah, so I remember when I was looking at what the few food diet was, essentially it was all unprocessed food, and it's very limited selection of foods. Right. So it just makes you wonder. It's probably because they're eating unprocessed food
and probably no added sugar.
Correct. There's no added sugar.
I think sugar and ADD is the connection that is definitely makes sense, even if it's just a scientific point of view, but the evidence shows it too, right?
Right. So especially the hyperactivity.
Yes.
We hear kids
eating
a cupcake and they're bouncing off the walls. 5 minutes later. Yeah.
Yes. Giving kids sugar, is such a common thing because sugar will, please them. It's almost a reward thing too. It starts this pattern of addictive behavior too.
Yeah.
So instant gratification.
Exactly.
It's a whole nother topic in terms of nutrition's the one thing, but then you're also rewarding a behavior.
Right. It's almost like giving a drug as a reward.
You're doing a double whammy now.
Right.
They're metabolically now addicted to sugar. And their taste buds as well.
Right.
Right. Now they can't have anything less sweet than a latte.
Right.
Or whatever it's called. frappuccino
Yeah.
that kids drink these days.
Right.
And also they know like, hey, if they're acting bad, the parents just give them something,
Right.
instant gratification, as opposed to helping to maybe explain or modify behavior, or do you know what I mean?
And
Like,
then when that cycle continues, the
the
problem just
cycle
gets worse and
continues,
worse.
and then when they grow up, of course, no surprise,
Yeah.
that they rewarded for their impulsiveness in a way.
Right. And
You
so
know?
why does sugar lead to hyperactivity? What is it about? Because why not fat? Fat has more calories per gram, right?
Right. Yeah. So
So
tell us.
or so why sugar? So what ends up happening is the sugar generates insulin release from the pancreas, and that insulin release actually drives energy into your fat cells because that's got to be stored somewhere, right? So
Yep.
when you consume sugar, that glucose gets converted to pyruvate, gets broken down in the Krebs cycle, and you end up, if you eat too much sugar, you end up generating excess pyruvate, which ends up getting converted into a fat called palmitate, and it's got to go somewhere. So it goes into fat cells, and
Right.
what ends up happening is the result is leptin. The hormone leptin is made from fat tissue, and that leptin acts on the brain, specifically the hypothalamus,
Right.
right? And then,
The hunger control.
and then that stimulates your sympathetic nervous system, and sympathetic nervous system is lots of energy.
Right.
You got to get rid of that energy somehow. So it's all this cycle of
Right.
okay, you got this energy to do it. It's got to go somewhere, and that's why you see a lot of people, kids with ADHD, they're fidgety.
Right.
Or whatnot, or they just got to do something, and that's really where the hyperactivity comes in.
Yeah, right. I mean, again, like I think it would be pretty dumb on our part if we thought that like the brain is somehow super like disconnected from metabolic health.
Yeah.
Right.
Yeah.
Like
It's all tied together.
At this point, it doesn't even make sense to even think that.
Yeah.
And especially we know that there's an interaction between gut health. I mean, look, people have side effects when they take medications. Mental health medications. One of the most common side effects is in the gut.
Yeah.
You have like so as soon as you start having serotonin, start working on like modifying it, of course. So that makes sense. People get anxious, of course. Gut is like one of the main things that like exhibits
That's why
symptoms of the anxiety that you're feeling.
Right. So selective serotonin uptake inhibitors and all these medications, right?
Course,
that affect the serotonin and whatnot. You hear lots of diarrhea, constipation.
Absolutely. So that explains that
upset stomach
as well. Yeah. Absolutely. So medications, you won't need medications for the most part if you're, I think, metabolically healthy and just like, doing the best that you can.
Right.
Obviously, given circumstances, things happen in life. And in those situations, if you need medications, fine.
Yeah.
You might need them temporarily, or you might need them if you actually have like, major depressive disorder and are more prone to having those. That's a different thing. Or you have, ADHD, and of course, taking the medication might help you.
Yeah.
Like I said, inattentiveness especially, it's hard to make kids focus in therapy when they can't focus to start with.
Or so maybe maybe medications
for a short period of time to help them, and then they, as they get older and develop those skills to strengthen that prefrontal cortex connection with the amygdala, and hippocampus, the limbic system. Yeah, you won't need it that much.
So basically, the medication can act in certain situations. It can act as a bridge towards getting you to focus enough to focus on the lifestyle.
Just like we do with benzos, right? Yeah. Like benzos aren't meant to be like people taking Xanax forever. That's a whole other podcast, of course. Right. We're gonna talk about that, but it's meant to be a bridge, or if you as needed. Right. Panic attack when I'm getting on a plane like BA and the 18. I think they use Xanax.
I ain't getting on no plane
all the time, but that makes sense. But in other medications, or especially stimulants, they have their side effects. I think that's a whole other conversation we'll have. I don't know how much time we have.
Okay, I think we have time for questions now for about a half hour or so. Okay, so there's a lot of comments and questions. Sorry if I can't get to them all here, but let's see where we're at with these. Okay, what do you say to a little sugar in coffee, but that's it a day? Sometimes a tablespoon in my cooking. So the general rule of thumb is you want to eat less than 25 grams of added sugar per day. The less, the better. But I think that's a very reasonable limit. Cherries at night. So cherries, it's a fruit. It does have sugar, but at least has fiber in it. So it's not gonna be the same as drinking, say, cherry juice. So I'd say cherries in general are fine. Just everything in moderation. Anne says ADD, ADHD is so overdiagnosed. That's
actually a great question.
Yeah.
That's a great question, and that's it's one of those, again, chicken and the egg. Are things diagnosed because we now kind of understand them better? Or are things overdiagnosed because society now is overstimulating kids? So they're like TickTock is now like almost breeding a generation that is, prone to not focusing longer. I mean, I was talking to someone younger who refuses to watch The Godfather, one of the greatest movies ever, because it's a 3-hour movie.
Yeah.
No one's going to sit there and watch a 3-hour movie anymore.
Right.
You know what I mean?
Right.
That was like, I have ADD and I watched it. It's an awesome movie, but I also watched it because I know the choice. When you sit there and watch a movie like the old days, pop in the VCR or whatever, you're there.
Right.
And they're in a movie theater, you're there.
So I think it's fair to say that everyone has less focus and concentration these days compared to before.
And also now society's pressure is on the productivity, right?
Yeah.
So the more productive you are, the better, right? So now everyone has to increase their productivity. So are they going to say they have ADD to use stimulants as a performance enhancing drug? Yeah.
Or maybe because they have all this incredible pressure to perform, to be productive, and all this stress to get things done.
Would everyone love doing Adderall? Yeah.
Yeah. So now that increased pressure to get things done is really overwhelming people's minds, where the mind is literally on stressed out, essentially.
Yeah. So you can say that part of it is a societal construct. It's a societal construct, a result of how we live in society.
And so now the lines get blurred more in terms of what is just, okay, they're not focusing as well versus what is true ADHD. And I do agree, it is overdiagnosed.
But that being said, there is a genetic component that's been proven with the statistical evidence. So that's there.
Right.
That's there.
Right.
Harvard, whatever. You go on their website, you can look it up.
If you looked at every person who is diagnosed with ADHD or they're labeled as having ADHD, and then you looked at all these people's functional MRIs, right?
Yeah.
Chances are, most of those are going to be normal functional MRIs.
And actually, that raises another really interesting question. ADHD, right? The core feature. I always focus on the core features. ADHD is a term that's in the DSM. Just because it didn't exist 500 years ago doesn't mean that the symptoms of inattentiveness, hyperactivity, and impulsivity weren't there.
Yeah.
Right? Just like autism, just because we didn't have the word autism, doesn't mean that someone like Isaac Newton wasn't high-functioning autism. You kind of know that.
Right.
Right? Those people existed, and it did exist. We just call them special or weird, or that's the terms that we use for people.
Right.
Stuff like this.
The term
hyper,
and that's a whole other subject. is the psychiatric terms that used to be used
and they're
would never be able to be used.
So forget about the people focus on like I want a disorder labeled on me. Forget about the label. I look at it as inattentiveness, impulsivity, hyperactivity. Is that just ADHD? No, right? Could be 20 things. Could be 20 things, right? And you got to think horses over zebras as a clinician.
Right.
It could be bipolar disorder. And in kids especially, the symptoms of ADHD are prodromal to them developing bipolar, and there's comorbid existence, right? Or like 70% or whatever the statistics are. Right. So that's already known, and this is prodromal, right? And they could be having, kids don't present with the classic bipolar manic necessarily like features. And also, when they're that young, they're not going to necessarily have it. It takes, I think, 7-8 years is the average timeline of when someone starts seeing a psychiatrist for even the mental health professional to be like, figure out this is what it is.
And that's a whole nother subject.
Because you have to follow them, of course, over time.
And that's a whole nother subject where everyone is labeled as something, right? Oh, yeah. if you get angry one time, oh, now you're bipolar. Okay, I mean,
and that's overdiagnosed in a way too.
Right.
Almost anything can be overdiagnosed.
Right.
I would say things are underdiagnosed. Actually, I would flip it, because the people that should be diagnosed probably aren't. There's a lot of overdiagnosis on, and especially with disorders that aren't there, and maybe it's a miss, or like I said, it's a overlap, and we don't know it yet.
Right.
Like depression, we treat depression all the time without knowing if it's really unipolar or bipolar depression.
Right.
Right. We don't know it a lot of times. The best thing is history taking. That's why you ask about family history. Someone that might have had, most likely, someone in their family that has severe ADHD or ADHD. Yes, there is a genetic component.
Okay.
Sorry.
That was
That's
good.
My ADHD going off.
That was a good point, though. That was a really good point that it's overdiagnosed. Okay. I have seen an increase in ADHD over the 8 years since I've been teaching. I'm not surprised by that.
Let me just say one other thing about that. Schools, right? Because I see a lot of kids and they need letters to get back into school, right? So here's where it comes into play, which is what I'm talking about. So for the diagnosis of ADHD, technically, it's a clinical diagnosis. Yes, there's assessments you can do because parents are going to like, oh, my kid have ADHD. It's a clinical diagnosis based at least in 2 different settings. So a kid in school, a teacher, get a good history from the teachers. Hey, this is, a Johnny or Jenny. They're inattentive, but what is the pattern? Are they
Right.
inattentive? Like, so
Yeah.
you first have to do really thorough history taking. No one should be able to give a diagnosis of ADHD in a 15-minute interview,
And that's why,
which is what a lot
right?
of the
So
online
yeah,
thing is
because
doing.
so what you're referring to is basically these companies that really looking to be
Right.
greedy and take advantage of things. So where they literally will target the people who have lack of focus on TikTok, for example. Um, the company will say, okay, we're going to put an ad on TikTok saying,
Mhm.
oh, do you have ADHD? Having a hard time
Right.
focus? Why don't you click here? And then they click there, and then what happens? Okay, all of a sudden you're tied into a nurse practitioner, psychiatrist. It's not even a psychiatrist; it's a nurse practitioner, right?
Whoever it is, it
So,
doesn't
so,
even
so,
matter.
so the
This is
bottom line,
shady. And
so the bottom line is you get tied in for a 15-minute visit, and in that 15 minutes you get diagnosed as having ADHD, and when 2 to 3 days after that, you're giving a prescription for Adderall or
yeah,
Vyvanse, and actually this contributed towards the Adderall shortage that we have now.
yep.
Correct?
Yeah, there's Adderall shortage because it was overprescribed. Again, like I said, performance enhancing drug for especially during COVID,
Yeah.
because they relaxed the rules on telemedicine, and so there were
Right.
and look, at the end of the day, like, why is ADHD overdiagnosed? If you're gonna conspiracy theorists, it's money.
Yeah.
Right?
Oh,
The
also,
diagnosis is how you get the meds. You have
yes.
to have diagnosis. Insurance
Yes.
covers your meds. Otherwise, without a diagnosis, like you have to pay out of pocket, which most
Right.
people can't afford.
Yes. And so the
Right?
bottom line is you can't diagnose ADHD in 15 minutes.
If you want to
At
be
minimum,
real,
at minimum,
no,
what at the minimum,
of course not.
at a minimum,
If you
what
want to be a
does
good,
it take?
at a minimum, it's at least an hour interview to start with.
Right.
But over the course of weeks to figure out like the patterns that the child has in school, the patterns that figuring out this history taking, like,
And really, there's no better, and really, there's no better place to do it in the setting where they're experiencing their symptoms, right, in school.
Yep.
That's
and,
really
and
the best
start
place.
with all the nutrition and behavioral changes first. We don't have to be like, oh, medications. Yes, sometimes, like I said, extreme inattentiveness and stuff like that, impulsive. Yes, it's hard to get them to do the
Also,
things you want them to do without medications.
the thing that we didn't talk about, lifestyle meditation,
mindfulness meditation.
mindfulness meditation, and really, what is that? You're literally
folks.
you literally focus on nothing except
right.
your breathing.
Yeah.
Right.
You're almost withdrawing from all the external stimuli, which is
you are
right. That's part of ADHD, is they are easily distracted, right? Easily distracted because their ability to filter stimuli. Our brain filters all these extraneous stimuli, and the signal that is the one that's most salient. They're like, okay, this is what you're going to attend to. This is what you're going to focus our attention and concentration on. People with ADHD, they have a very limited capacity to do that. So the background noise is high.
It's
like
so
a radio station.
It's what's called suppressing the monkey brain, right? Because we all have thoughts that are always entering our minds, and whenever someone's meditating or doing mindfulness, you're going to have thoughts that come to you, and it's impossible not to, right? Even people who meditate for 30 years, monks, whatever, they're going to have thoughts that come to their brain. The key is to do your best to focus on relaxing, focus on the breathing,
right?
And try to not focus on anything else.
Right.
And when you do that over time, especially on a consistent basis, it helps to relax the brain, right?
Yeah. And that's where CBT comes in too. Right. And we're talking about that. There is that connection between Eastern Buddhist philosophy basically and CBT, which is being able to like regulate your breathing and not letting your autonomic nervous system take over and hijack your emotional response. Yeah. Because you're now able to regulate it. You're regulate it. You're better at like actually being aware. Yeah. Self-aware of that. So that's a huge part. Of course, hard to do in kids. Adults, it's hard enough.
Okay, let's take the next question. All right.
Yeah, we got here only the good questions.
Meds help, but dosing is critical. Yes.
Well, actually, let me touch on that. Not only dosing, but I would say the scheduling of the doses, right? A lot of times, clinicians just maybe, you're just like, okay, we're increasing the dose, pressure from the parents, like, or school, kids getting back into school, right? The reason why ADHD is also overdiagnosed is because, like I said, the kids need the meds. Why the kids need the meds? Because the school won't let them back in. They need a letter from the psychiatrist saying, Johnny or Jenny is too disruptive. Should they be in a special ed kind of thing is more conducive to them? Yes, that's a whole other thing. Social issue. But if we're talking about like how are they going to get back in without being suspended or staying suspended for 2 weeks, yeah, I got to put them on meds. The
Mhm.
behavioral therapy is not going to help them in 1 week to get back into school.
Yeah.
The meds do. Side effects, of course, there's always side effects to anything that you're putting in your body that's not natural. There's going to be something. So yes, diet, exercise, all that stuff probably takes time, and so sometimes meds are necessary to get them going. That being said, the other thing too that I wanted to touch on was what was there was some other part.
One question is, what's the actual prevalence of ADHD among children and adults? Hard to know.
Let's see. Yeah, I mean it keeps changing, right?
It keeps changing.
It keeps changing.
It keeps changing, and it's also you don't know who really is diagnosed and who's really
and
not diagnosed.
There's another thing I want to say. Adult onset ADHD. I know that's been something that was asked last time we talked about it, and it's now because everyone's going to these online things and saying, I have these symptoms. That's why history taking is critical. Did they have it from get-go as kids? Adult onset ADHD, ADD is controversial, right?
Yeah.
Possibly diet related, possibly whatever related. It could be, like I said, inattentiveness could be possible, depression. You have to rule out so many other things.
So I'm going to interrupt you here. Okay.
Please do.
So Ninja Visible asks cognitive behavior therapy, because
Yes.
So I think it's hard to know if it works specifically for ADHD, but can you just explain what
Right.
CBT is
CBT.
and why it might be helpful or beneficial in general and for ADHD possibly?
Well, the evidence for sure shows that for anxiety and depression, it's like, yes, it works. And I used to run CBT groups when I was in training, especially for anxiety and phobias. CBT in its essence is
I just want to interrupt you. So lots of people with ADHD will have anxiety because the anxiety stems from
inability to focus and getting in trouble because that's the anxiety. Like,
and so they're
to meet deadlines.
Hang on.
Sorry.
So lots of times, right? They feel shamed
yes.
for their ADHD, right? They feel shamed that they're doing something wrong. It's not what they're doing is unacceptable, and they feel shamed, and that generates anxiety in them, right?
And that's just like them completing tasks. Yeah, you're absolutely right. Anxiety. We have to remember the personal aspect. The thing is, they're also impulsive. Remember the impulsivity and inability to really monitor their affect, their emotional regulation. That affects their personal relationships. They'll do things or say things impulsively. They don't actually mean it. They're not like mean in the sense that a sociopath would be, like, I'm manipulating you on purpose, and that's why I'm being mean to you.
Right.
Yeah, they'll forget your birthday maybe because of ADD, not
Right.
because they're gonna forget your birthday because they don't care about you.
Right.
There's a difference.
Right.
There's a difference. I think that difference people need to understand. Right. Yes. Do people use ADHD as an excuse? That song, I have ADD, blame it on my ADD or whatever he says.
It's also just like with anything else.
Actually have it. They do suffer from it.
And also, it's just like with anything else, right? The bad ruin it for the good.
Yeah.
Right. So for people who don't have ADHD and or they're using that as, it's for those who
Yes.
don't have it and they're using that as an excuse, versus people who truly have ADHD, then they get a bad rap.
Well, look, we went to medical school together.
Right.
Medical school, probably law school, these kind of schools.
Yeah.
Half the kids are on Adderall.
Correct.
Are half the kids die ADD? No. They're on it as a performance-enhancing drug because it helps them focus and pay attention.
Because they need to get 4.0. They need to
be up for like 20 hours studying, all that stuff. Yeah. So, and that's stimulants started off by giving it to people in the military so they could
back in World War II, right? The first amphetamines were given during World War II to boost production, right?
Boost production and stay up and do so yes, there's that aspect to this performance-enhancing aspect, and so that's why it probably gets abused. That being said, people probably self-medicate using street drugs with like amphetamines and crystal meths. So it comes down to harm reduction too. Sometimes those people they'd be better off taking the prescribed stimulants than doing street drug stimulants because you never know what's in those. Right.
Yeah. Palmina said ADHD people forget birthdays. I disagree. LOL. Maybe if they don't like you. LOL.
That was all. Yeah.
Everyone forgets birthdays. Come on.
Especially guys. Oh, well, that also raises the question, guys. More likely to have ADD.
Someone says cognitive behavioral therapy does not work in ADHD patients because there were studies done in the 90s. In fact, made symptoms worse. Yeah, I'm not so sure.
Okay. Yes. Okay. But that's a good question.
Yeah.
I would say, again, the essence. What is CBT? First of all, what is CBT? Right. Like the essence of CBT.
Well, first of all, it's cognitive behavioral therapy.
Right. But what does that mean?
Explain.
So what that means, and CBT could be used. I think it could be used for anything if used right, appropriately. And the person that knows what they're doing is in targeting again. You're right. They do CBT for psychosis. But if someone is so disordered with their reality testing that they can't partake in a CBT session, like they're that psychotic and delusional, yeah, it's not going to work because they can't participate in it, right?
Yeah.
So they do need the medication. Yes. So CBT has, limits. We do use CBT for delusions and things like that they can work with, because the patient can engage in the therapy. So yes, CBT is cognitive reframing,
Okay.
right? What happens is like the thoughts that generate the anxiety.
Okay.
I get the point with the ADHD in that ADHD, we're not saying that necessarily it's thoughts that are driving it.
Okay.
In fact, it's an inability to focus. But you can use CBT to help with the anxiety. And when
That
someone
stems from the lack of focus.
especially with the behavioral, like, wanting to like get up, like getting anxious, I can't get up and do this, like having them learn how to like sit in a spot.
Yeah.
So hyperactivity aspect of it, the CBT can help.
Okay.
The inattentiveness, yeah, if you're not attentive enough to participate, nothing's gonna help.
Right.
Right?
And that gets back to using sometimes
mindfulness. But the mindfulness
right.
part, CBT is more than just that. CBT starts with relaxation techniques and deep breathing and mindfulness. If nothing else, that has to help.
Yeah.
Right?
Yeah.
Or at least it has to help you, even if it doesn't. It has to just make you a better person in terms of regulating your emotions, which has to help you with ADHD symptoms.
Yeah.
It has to help you regulate it better. Of course, that's why it's been like shown.
Yeah. Talk about differential diagnosis. Is it true most people are likely to be struggling with anxiety instead of ADHD since symptoms overlap so much?
Great question. Yeah. When we're talking about ADHD in kids, especially as a prodromal to bipolar, potentially, they should always be on the differential. Anxiety, yes, these are all on the differential. They're all, I think they're spectrums, right? Like anxiety, is it anxiety because of the inability to pay attention and you're always getting in trouble, right? In classrooms, of course, the kids are anxious.
So basically, I think that's a great point because you could have
what's driving what?
What's the chicken and what's the egg?
What's
because if you have anxiety, you're not going to be able to focus as much.
Exactly.
And the same, and the vice versa is true, right?
And also, again, remember children, right? Children, it could be abuse going on, it could be trauma, something could be stuff going on.
So when we talk about things that have been seen to be highly correlated with the cause of ADHD, we talked about genetics, we talked about epigenetics, and that's the other thing that we didn't talk about is stressful or traumatic events early on.
Parents going through a divorce, different environments, changing environments, different school. Someone brought up autism, like the last video, which, again, inattentiveness, it's kind of its own, like, again, I would just look at it as that autism, it's its own, so it's a different kind of thing in terms of, the deficiency is more of a social connection, not necessarily attention impulsivity necessarily, although yes, there's overlap in both of them. But I would say good history taking. This is why, like, the 15-minute online thing, like, how good of a history are you going to take as to what is the cause.
So getting back to Elizabeth's question, so if ADHD leads to, in many cases, anxiety, or anxiety is causing someone to not focus well, even though they don't necessarily have ADHD, either way, CBT for that anxiety would be beneficial in most cases, right?
Right. Finding out what the source of the anxiety is.
Right.
You just have to be like Socrates. You just ask. The more you ask,
right.
Anytime someone says something, there's always got to be follow-up.
So getting to the core. So getting to the core reason of why that anxiety is being generated.
What is it? Generalized anxiety about everything? Is it specific to a certain thing?
Okay.
I have financial problems. I'm starting a new job. I'm getting a divorce. I'm anxious because of that.
Okay.
Situational stuff.
Right. Right.
Is it not situational? Is it just I've always been an anxious person, worrying about how
everything
from the day, from the minute I wake up to the time I go to sleep.
Yeah.
Right. So the nature of the anxiety, you always have to get to the nature of what is, and that's a whole other thing. And yes, nutrition is going to help.
All right. Irie says pot is my only medicine. That's a great point because so many people with ADHD.
And we're in Las Vegas where it's legal, and I hear people say it all the time. I can self-medicate.
And that's a common question is, what about pot? So can you touch on two main things? One is, why do people use that for ADHD or to help with ADHD? And is it good? Is it bad for ADHD? What are your thoughts on that?
That's an excellent question. And, in general, what the understanding is when kids like smoke, at least with ADHD related, it reduces some of the anxiety, which again, inability to focus, smoking pot, kids say like helps like reduce, first of all, like, them to focus, which basically is, I think, withdrawing from like the ability to focus on any particular thing. again, they're getting high. Usually they're, it does calm them down. That's what they say. And it helps them escape from like the world of
For most
excessive
people,
stimuli.
for most people, right? Because for most people, when they use cannabis, it does help them calm them down. But
Yeah.
for some people, it has the opposite effect. It has the
Oh, yeah.
paradoxical.
Right.
We talk about paranoia, anxiety from it, and so you have that subset of people who who have the opposite effect.
Right. So yeah, just to be clear, cannabis not recommended. They've done the studies because it does affect cognition,
Right.
formation of memories, cognition. So kids, like if you're gonna do smoke pot, like of course I'm not the police, I'm not a probation officer.
Well,
Like, don't do it. But the study
especially
shows
the
it does diminish your IQ,
especially
especially while your brain is still developing.
especially the you just said it.
Yep.
Especially the developing brain is most, because that's when most your brain is most plastic in your
Right.
first 25 years of life. I mean,
if a teenager's smoking pot chronically, right, from like 15, 16, their brain is developing until 25, right? So they're putting themselves at a disadvantage. I think the studies show like you lose like an average 6, 7 IQ points. That could be the difference between getting into college for a kid, right, or make something, So
yeah,
it's a huge thing. It's a huge thing.
All right.
And it's a band-aid. It means you're using it as a crutch. Right. If you're just smoking pot to get high once in a while, that's a different thing. That's not, I wouldn't pathologize that. But if you're doing it as a crutch every day to escape something, escape a symptom, then we should address the symptom.
Yes.
With, lifestyle changes first.
Okay. Yeah. So that someone says the developing brain. Yeah. I mean, that's the thing is once the brain is starting its development in the fetus.
Yeah. And we haven't even, that's a whole nother topic.
Right. No, but from that point on, I mean, it's most plastic, meaning it's most moldable and most under the influence, if you will, by everything that you consume and do.
Right.
And the later on in life, I mean, the more you age, the less it's plastic. But so really the first, I mean, depending on how you want to break it down, but the first few years, the first 15
Right.
years, the first 25 years, it's not really solidified, so to speak,
right,
until you get to 25.
Well, it makes sense because,
but it's not ever truly solidified.
Yes, they used to think that the brain, stops, being plastic. That's been shown to not be correct. And also, you can after strokes, people recruit different parts of their brain. So it's been proven you can recruit parts of to be active if you actually do that effort.
And it's like what we were saying from the beginning is that when we talk about these lifestyle changes with meditation, with exercise, with nutrition,
right,
you literally have control over what your neurons are doing with the synapses in the BDNF, brain-derived neurotrophic factor.
Look, just as a side point, I want to say this again: smoking, right? Nicotine's been shown to maternal mom smoking, while they're pregnant, been shown to actually lead as a I don't know if it's a causation or association, strong association.
Yeah.
If it's not proven as causation with nicotine exposure and ADHD.
Right, just like we know that with fetal alcohol syndrome, where people who drink alcohol excess, they're more prone to dementia, cognitive issues. And so the bottom line is you can do things to either make your neurons better or worse.
Yeah.
The more things that you do that are better, the better your brain's going to function. And the more things that you do that are worse, the worse your brain's going to function.
Pruning, pruning of neurons is something that happens the first few years, right? I think however many neurons like an infant has, they lose 50% of that.
Yeah.
But what happens is whatever they have, they prune the neurons that they need.
Right.
And while during that
process, it's like weeding out the garden.
It's weeding out the garden, and also gets your the toning of your background, how much you're going to respond to the stimulus, right? Those are the informative years of that stuff.
Yeah.
So we're going to a more basic element. But yes, in terms of going up to teenage 24, 25 years old, the brain, the prefrontal cortex and the cortex is still evolving, even though the limbic structures are, they're more primitive. So they're going to be there. They control the emotions and the impulses and the urges. The prefrontal cortex that reins that in, that has the self-reflection and self-awareness ability, which obviously, is affected in ADHD.
Yeah. That
part develops over time and can be modified over time. And so, yes, that part.
All right, Candy Slim 501 says, thoughts on psilocybin treatments. I'm a fan. That's a great that's a great question, because less than a month ago, there was a study published in the New England Journal of Medicine, which is a big deal that it got published there, is that they actually looked at psilocybin for the treatment of depression. And the long story short from that study was that yes, it did. So one single dose did help depression. The caveat was you needed the higher dose for it to work. And the other caveat was there were more side effects associated with that higher dose.
Right.
mainly being euphoria and headache, I believe. So
Euphoria.
anyway,
God forbid we experience euphoria.
right. So anyway,
Okay.
so what do you think about that?
Yeah, that's a great question.
I mean, that was for depression though, not ADHD. But,
Right. I think in general, yes. So there's no like actual like studies that have like been able to like research on that for ADHD in particular. My guess, I mean, again, it's one of those things like it might help you calm your anxiety, help you like focus. The thing about psychoactive things like this that have been shown, studies shown to help, like especially with trauma and depression is shown to help with in a controlled environment in a therapeutic setting with a therapist, not going out like in
right. So
Vegas
like
Strip.
so like when you say trauma, so like people with PTSD, right?
It's shown to help with trauma and help people process it, and again, it's the research is showing that that's actually is helping. How it's helping? Is it placebo? Is it they're with someone in an environment like again placebo is such a strong thing. They're developing a connection with someone else while they're having a microdosing,
right.
Which isn't like which is fractions of what people probably think of when they're tripping on mushrooms,
right.
right. So that it doesn't you don't have the psychoactive like visual hallucinations, but I think you're just able to maybe connect emotionally and verbalize what you want to say,
right.
I think that part is more important and actually helps them verbalize what they're saying and then get validated by therapists and help them work through it. Because a lot of people just have a hard time connecting with their emotions literally, and the microdosing helps them do that.
And that's why, so MDMA, which was known as ecstasy, right? So this was a drug that got a bad rap, and there's these false things that came out back in the day where it pokes holes in your brain, and that's been disproven. That's not what MDMA does.
Right.
But this drug actually is probably going to be legal in the near future, and its specific use, correct me if I'm wrong, is going to be for PTSD in that setting that you're just describing, and the reason is that this drug, it actually helps us feel emotionally connected.
Well, it's serotonergic. It's serotonergic, obviously, and obviously regulates autonomic nervous system. Those are like two key features.
But when you hear people who take this drug, right, it's basically
it's a social drug.
They feel love and connected with others.
They do, yeah. And so, right. And I remember in residency, like my supervisor used to be like, definitely ask the person the drug of choice. A lot of people do a lot of drugs because that'll give you an idea of what they're trying to achieve. What is it that they like?
What are they seeking?
They're seeking like someone wants social drugs, someone downers, someone just opiates, someone wanted uppers. Like it depends on what they're seeking, and that gives you an insight into what they're trying to compensate for, possibly.
Yeah.
Right. So, anyways.
So Candy Slim said psilocybin was a total reset and positive way for me. I'm so stoked on the early studies on microdosing and controlled trip. So thanks for sharing.
It sounds dangerous. I mean, it's less dangerous than living your life with PTSD.
But also,
one, and two.
It also that's why we have to go with the studies and what they show.
Again, therapeutic environment. Yeah, it's less dangerous than probably the drugs that people take. Over that. That's what I'm saying.
Yeah, and then so Nenji, great point. The dose makes the poison, right? So anything in excess will do harm.
Protein is good for you, but if I told you to take a gazillion grams of it, you have kidney failure and probably
that's a great point. The dose makes
middle
the poison.
path, like Aristotle said.
Please speak about the importance of oxygen and what things prevent the brain from getting enough of it. So oxygen is really not an issue for people as far as getting to the brain, unless you have a specific reason as to why the brain's not getting oxygen. So
if you're talking,
let me take this.
Okay. He's a pulmonologist.
So your brain can't live with oxygen. Basically, about 4 to 5 minutes, if your brain goes without oxygen for that amount of time, the brain dies. It's that simple. Most people have no issues with getting enough oxygen to the brain, even if you're chronically hypoxemic, meaning you have chronically low oxygen levels. They're still getting enough oxygen to the brain where it can function normally. So that's not really an issue in terms of the general population. It's only when you get in certain situations where you're not getting any oxygen to the brain.
Obstructive sleep apnea. I was just wanting to bring that up.
Wait, Canadian Chris says, is there a super smoothie for ADHD? Just kidding. But these recipes on your channel are awesome. Thank you, Canadian Chris. So the thing about the smoothies that I make, these super smoothies as I call them, is that they're packed with the things that you need and low in the things that are bad for you. So what I'm saying is they have tons of omega-3 fatty acids. They have tons of fiber, both soluble and insoluble fiber.
And they taste good. I've tried them.
And they have antioxidants, vitamins, and minerals. and no added sugar. The only
Right.
sugar comes in from the limited form from the fruit, which is also adding the fiber to it.
Right.
So that's the thing is, so for example, most of my smoothies have anywhere from 15 to 25 grams of fiber, depending on which one. But when you look at how many people, if you surveyed everyone and said, okay, how much fiber are you getting per day? Most people, it's about 10 to 15 grams of fiber per day. That's half of what people should be getting.
And they probably overestimate what they, right?
Yeah.
This is a classic thing. People always overestimate to tell their doctors.
Yeah, the 42 grams of fiber, the 42 grams of fiber
and they
in
always
bread,
minimize
that's
the
not
bad stuff.
yeah,
Well, I'm not
yeah.
smoking that much. I'm not drinking that much.
Yeah.
Okay.
Yeah. So the bottom line is most people don't get enough fiber, and most
Right.
people don't get enough omega-3 fatty acids, and most people consume way too many grams of added sugar per day. And all these, so when you're not doing those things, it's definitely going to
Mhm.
impact your brain.
By the way, someone mentioned something about PTSD. Yeah, of course. Great, great question. Great point. We were talking about trauma, attention, and concentration. Yes, of course. Stress and anxiety are going to affect your attention and concentration. Stress and anxiety can be caused by any number of things. It can be
Right.
medically related. You have medical illnesses causing it, thyroid issues, things like that, especially endocrine hormonal issues. And you can also have, of course, diet, metabolically, which is probably majority. And of course, it can be trauma related. It can be related to generalized anxiety. It can be related to social phobia. It can relate to any number of things.
Mhm.
And so that's why 15-minute diagnosis is not, that's the whole
Yeah.
point. You have to do a proper
And what we'll do,
history take.
and what we'll do in future videos. So we'll select a mental health topic every week.
Yeah.
So depression, anxiety, PTSD, and then
Yes.
and so that way we can try to get to as many of these topics as possible.
And by the way, in case you're wondering, people end up with like 5 diagnoses.
Yeah.
Generalized anxiety, PTSD, bipolar, this, that. This is common, right? Because
Right.
I've inherited patients. That's because it's like blind people feeling the elephant, right?
Mm-hmm.
Because we don't still know. We're still trying to categorize how these symptoms all match and relate. It's just most things are on the spectrum.
Right. Nothing's
Anxiety
really
is all
black and white.
spectrum
Everything
Right.
is a gray area, especially in psychiatry.
Yeah.
Right?
So of course, people end with 4 or 5 diagnoses. I'm diagnosed. A lot of times, the diagnoses have to be put in because to get your insurance company to come. So I get that part. Overdiagnoses happen because of that usually, and also because we don't know. We're grasping at the elephant from different angles. So anxiety is the elephant. If you grab it from the tail, it might be PTSD. If you grab the thing, it might be that.
And also too, it gets back to your point earlier. It truly, for generally speaking, to make a psychiatric illness diagnosis,
7 years I think was the average.
7 years, right, on the average, right?
And that's mental health professionals.
Especially when it comes to personality disorders, you have to get to know
Right.
someone over a long period of time and see their actions.
Oh, that takes
right.
That's sometimes could be a lifetime, like
right.
figuring out something. So yes.
So it's very nuanced and it's very much a gray area, and there's so much overlap. So it's very tricky.
Yeah, and having the coordination, like ADHD, right? Are you getting the history from the teachers as well as the parents, as well as like the social situation, the biology, everything? You have to all put it together to make the most accurate, clinical kind of picture. Otherwise, yeah, it's easy to be like, oh, they just have ADHD. No, maybe there's abuse and trauma going on. Maybe there's a life event going on, this and that, adjustment disorder, which is basically a thing of saying you have a life event and it takes you a few months to adjust to it.
It's also easy for any adult or even teenager for that matter to Google, okay, what are the symptoms of ADHD? And then when you go to see someone, say, okay, yes, I have that.
Right.
Yes, I lose my sunglasses all the time. Yes, all that stuff. So
exactly. These days, like I said, we grew up in the era we had to go to the library, check out articles that were actually peer-reviewed journals. Nowadays, if you just Google it, you'll find anything to support what you want to believe in. Trust me. Yeah.
Okay, well, that's an hour for this one, and thank you for joining us. The plan is for next week to do anxiety.
Sure.
Okay. All right. So
we'll do performance anxiety.
Okay.
We'll do. Was low. Someone made that.
Okay. Yeah. Sorry for the technical issues. We're trying to get better. I think it's getting a little better every week.
I should have done that before.
But we're gonna continue to improve this. I'm actually very excited to keep this thing going, and to have you guys coming back. And I'm very much looking forward to next week. So next Sunday, if you're available, we'll figure it out. We'll let you know though. Just stay tuned for that, and we'll focus on anxiety for the next one.
Yeah.
And we'll go over there. So
absolutely. Thank you guys for.
Thanks again.
The questions were amazing questions, and thank you, Dr. Hansen, for this platform.
Thank you. See you next week.
Rock and roll.